at the Pyle Center today to do the sort of first ever conference by the Center for Financial Security in partnership with the Robert Wood Johnson Foundation to bring together a group of people here at the University of Wisconsin who are working at the intersection of health and household finances. And the real goal of the conference today is to get a bunch of people who are working at this from different directions together and starting to talk about research and potential areas for collaboration.
When we begin to think about the relationships between financial security and health, a number of questions arise. I think one of the foremost questions is how we think about measuring both financial security and health, because in many important ways the particulars of these measurements are going to be very influential in the way we both analyze these problems and design policy.
One of the things that I think is really important about this issue of the health-wealth nexus is the complexity of the issue. There are bidirectional effects, there are cyclical effects, and I think that we need to find a way to embrace that complexity. It's great to simplify issues and try to find one cause and one effect, and that can teach us a lot about the world and about these situations, but it doesn't show us anything about the real world, because that one cause and one effect is influenced by so many other spheres of influence that simplifying it that much, while that gives us good information, doesn't give us the whole picture.
The area that I study is the relationship between poverty and child maltreatment. And there's a long literature showing a strong correlation, inverse correlation between income and the risk of child maltreatment. So one of the things I'm interested in understanding is what is the causal role of poverty or income in child maltreatment. And we've had tons of research demonstrating this relationship in a descriptive way. I think there needs to be a bit more attention to this in the research in terms of isolating that causal role that poverty may have. On risk, we know there's a good chance we're going to see many of them again, but they've never been sort of systematically targeted.
Once we've teased apart these issues of income and wealth, and I think looking at the mechanisms by which those things get under the skin, affect people's physiology and affect their health, and then how, in terms of larger groups, these differences are inequitably experienced, and so therefore resulting in very large health disparities that we see both from the point of view of race and ethnicity and from the point of view of socioeconomic status, because unfortunately in this country those two things are highly conflated.